try to do what President Obama asked us to do, which is to improve quality and reduce costs. So the question is, how do you do that? And I think it's by identification of something we call best practices. We have this system that measures results, and we find out who has the best results. Then we go to that hospital and we poke around for a while and try to understand what it is they're doing that gives them good results. And once we understand that, we can distribute it to the other 49 hospitals in our group, and hopefully they all get better when we do that. So it's this sharing of best practices that's really at the crux of the system.
So very early on in the program, one of the things that we were focusing on were rates of use of the emergency department after bariatric surgery. Very early on, we noticed that varied very widely by site, and overall about 8% of patients wound up having an emergency department visit within 30 days of their surgery. And so we looked at data and identified some best practices, then implemented them around the state, and the emergency department visit rate decreased to about 6%.
The uniqueness here is it's not physicians trying to hide data or say, you know what, it's none of your business. People are open. These are physicians across many institutions. We are fortunate in Ann Arbor, we have only one hospital, but these are sometimes hospitals that are across the street from each other. Yet we'll have physicians sit together and say, okay, let's work together and figure out what's the best way we can solve a problem, or we can improve the quality of care, or if there is no problem, how can we do a better job of what we already do? And that is unique.